Introduction to kick off with. My name is Gill Bridgman. I'm 67. Oh no, you're not. Oh, you feel a bit slow there. I'm retired. 3 grown-up offspring. I live on my own for one reason or another at the moment, and I've been attending these conferences since 2012. They have been an enormous support to me. I have built up friendships. The first one I went to, I'm still in touch with people. We've all had different treatments. We phone up, and it's been fantastic. So I really do encourage you to use the Support Association. Right, I was diagnosed in 2012. I was under watch and wait for five years. I thought I'd get away with it. I thought I'd keep under the radar, but it did come to a head. I was originally living in Bedford, and I was under the care of Northampton. I later moved to Leicester, and I'm now under the care of Ben Kennedy, who's been fantastic, but that's another story for another day. Right, in May 17, this condition raised its head, and it presented as autohemolytic anemia. I was away at the time. I was on a walking holiday down in Devon, and everybody kept saying, "You do look ill," which helped me an awful lot. "You do look terrible," and it got worse as the week went on. I had no energy, and I literally couldn't put one leg in front of the other. I was in a poor way. Anyway, when we got back, I went to the doctor, got into the surgery, burst into tears, and I had a hemoglobin of 40. And straight into hospital for blood transfusion. And that was the beginning of a long journey, of which I'm still on, I think. The next steps after that, I'd done a bit of research as to who I wanted to be under, and I think the more you know about your consultant, the better. And I'd set my heart on being under Ben Kennedy. And I'd met people at other conferences who'd spoke very highly of him. And I think he was a guy that I could communicate to. He spent 12 months managing me with this autohemolytic problem. I'll try and explain it so that everybody can get their head round, because I know there's some people here who find it all very difficult. It's a whole new language. My body, for one reason or another, unbeknown to it only, had decided to hammer my red cells and destroy them. I was making them, but they weren't surviving, and hence I was exhausted, absolutely exhausted all the time. The treatment was blood transfusions, steroids, which does affect your bone density despite the support. Hence, when I tumbled over the other day, I think that might have been instrumental in breaking my arm, but that's another story. So it was steroids and prophylactic medication for a while. After a year of managing the autoimmune issue, after a year, it was evident that more robust intervention would be needed. And I don't know how these consultants know, but they do. The time's going to be right. He said it's time nearly to start the firing gun. And another thing I admire with this is that there's no one-size-fits-all. There's different treatments for different people with different genetic, all the rest of it with such and such deletion, this is going to suit you better, and FCR seemed the right thing for me to do. And I started that in May, I think it was, last year, and finished in November. Prior to the FCR, I had to have 6 infusions of rituximab to get me ready to cope with the FCR. Generally, it went quite well. There were a few bumps along the way. There were a few infections, a few admissions into hospital with blood transfusions, but generally it was okay. And then when I had my bone trephine, I think the terminology is, and the aspirate, I was delighted after 6 months that I was in MRD, whole new language here, minimum residual disease, and there was no evidence of the CLL in the bone marrow. Very, very pleased, but there's always a little add-on, isn't there? But it's still there at very, very low levels. I think that would be the main message of my talk, that when the chemotherapy stops, the journey's not finished. It goes on. It takes a long, long time to get back to almost press the reset button, to be where you want to be. I finished my chemo in November and I'm nowhere near where I should be. I feel much, much better in myself, but I know we've got still a long journey and still a few unanswered questions. I think that was a big shock to me, and a lot to other people as well. You think chemotherapy finished, job done, and it's certainly not like that. It takes a long time to recover. Now, where am I now? Where am I now? My problem is now neutropenia. I'm not making, I don't know if I'm not making, but there aren't enough neutrophils in the blood. We don't know the cause of it. That's my issue at the moment, and I'm doing GCSF injections, which is a hormone, I think, man-made, I don't know, artificial, to stimulate the bone marrow to make these little good white cells neutrophils needed for infection control. So I feel a little bit vulnerable, and I'm always washing my hands and trying to encourage people to wipe my worktops and all this sort of thing. But that is what I'm trying to address at the moment, but I feel much better after the chemotherapy. The injections, and there are probably people here who've had injections, I'm going to do what Olga does. Can you put your hands up, please, if you've had GCF injections? Jolly good, that's great. I don't know what about you, but they make me feel awful. Every joint aches. Did it affect you like that? Every joint aches, every bone aches, every muscle aches. And then, but still, there we are, getting used to it now. So it's an ongoing monitoring. Ideally, I'd like to be off medication. I live a day at a time. People say, you know, how do you forget about it? I don't think you ever forget about it. It's like a nap that's running all the time in the background. And another way of thinking about it is as tinnitus. I've had tinnitus in the past, buzzing in your ears. And it's always there, but you learn how to cope with it, you learn how to manage it. And I think that's what we all need to do, is to learn how to manage it. So what to take away from this talk? The most important thing is that even in the limited time that I've been ill is not the word I want to use, had this condition, there's been enormous strides forward in the armoury of the treatment. I would really advise you to use the support of the CLL Association and to network with as many people as you can. There's a great advantage in developing a robust and honest relationship with your consultant. We're very fortunate if you can do that. Living with uncertainty is very, very stressful, as we know with all the political hoo-ha shenanigans going on at the moment. Living with uncertainty. Try and keep positive, accept it, talk about it, ask questions, prepared in advance for your consultant. Don't just, because I walk through that door and if I haven't written anything down, my mind just goes. Mine's gone most of the time anyway, but it goes completely then. So poor old Dr. Kennedy, I go in with a long list of prepared questions, and he looks at me and says, God, it's that woman again. But he generally is quite patient. It is a problem, but you just take a day at a time, a week at a time. And when I was doing the job I did up until a few years ago, which was teaching, funnily enough, and we had a phrase about problem solving, and we said, you can only eat an elephant a spoonful at a time. And that keeps me going. It's a big problem, but you can only do it in little bites. And I hope there will be an end to this, but having said that, I think it's going to be ongoing monitoring, and it's built into my life now. And in between the appointments, I just try and get on with it, really. Just one other thought, which I have found difficult, is people forget that you're living with this. And because you're vertical, you can stack a dishwasher, you can have a conversation, you can do all the things that normal people, whatever they are, I've never met any normal people can do. People forget that what you're dealing with. Since I've had my arm in a sling, it's been fab. Peter jumped up and said, oh, I'll get you a cup of coffee. People on the bus sort of give way. People on the pavement give you lovely little smiles. Oh, poor old dear, you know. And that's quite hard when you've got hemoglobin in your boots and, you know, you're struggling after chemo, and yet you can have an animated conversation with somebody. And, you know, anyway, maybe I need more TLC, I don't know. Okay, thank you very much. And I keep looking at that clock because Olga said we've got to be spot on. I don't want her to tell me off. Okay, but it is what it is, as my daughter always says. I think my family have found it very hard to deal with. They're 40, 38, 36, they're married, they've got their own lives, and as one of them said about the other one, they haven't got, so-and-so hasn't got enough bandwidth to cope with this. Doesn't mean to say they don't care, but you know, with a 2-year-old and a 4-year-old and a job and a new baby on the way, and they haven't got enough. It's not that they don't care. So that's my philosophy anyway. Okay, thank you for listening to that, and good luck.